Good morning, hello, welcome everyone to today's broadcast event. My name is John Adlam, and I'm a consultant psychotherapist in the Forensic and Offender Health pathway of South London and Maudsley Mental Health NHS Trust. Welcome to the broadcast. My role in the Trust is to coordinate the provision of reflective practice groups across the pathway, so helping staff to think about the complexities of the work that they do. In this series of broadcasts that we've been hosting through the autumn, we're exploring how psychological therapists across a wide range of backgrounds and practices and trainings are working with local community groups, and particularly those groups foregrounding the resource that is the lived experience of mental health difficulties and distress, to help make our community stronger and better able to resist and respond to different kinds of adversity, and ultimately to bring about meaningful and lasting social change. Health and social inequalities are the sort of targets in our sights when thinking about this. And this series of broadcasts has emerged in the circumstances of the pandemic, and the circumstances of the pandemic have illuminated societal problems that were there all along, but the COVID provides a magnifying glass, and the series of broadcasts is here to puzzle out some of what we're seeing in light of the pandemic. Very sorry to say that one of our colleagues couldn't make it today. Robin Lockhart has had to give apologies, and we'll try to keep in mind what his contribution might have been as we go along. Please do feel welcome and encouraged to sort of participate in the broadcast, so that we don't feel alone in the studio, so to speak. Ask questions using the question and answer function. Comments welcome. You're also welcome to contact us afterwards if you want to follow up anything, to contact us via the web link. Okay, so I'm going to ask our speakers to introduce themselves first. So perhaps Finn, you could introduce yourself. You're on mute. You're on mute.
I'm Finn, and I'm the Restorative Justice Practitioner based at River House.
Finn, thank you. And Julie?
Good afternoon, my name is Julie Clark and I'm the Restorative Service Manager for Calm Mediation Restorative Justice Service.
Thank you. And Gerard?
Hello everyone, my name's Gerard Drennan. I'm Head of Psychology and Psychotherapy for a part of the SLAM Trust called Behavioural and Developmental Psychiatry, but I work clinically within the forensic mental health pathways for the service.
Thank you. So Finn, I thought I'd ask you the first question. Could you tell us something about the place of restorative justice in a forensic mental health service?
Sure. Good afternoon, everyone. Thank you so much for attending this online broadcast. I work in the forensic mental health part of the Trust, and we meet the needs of patients who have committed harm whilst they're unwell. So what on earth is restorative justice practitioner doing in mental health service, you might ask? Well, at the South London and Maudsley, we've introduced this new focus on restorative practices through the Restorative Circle project. You might ask, why do we need that? Well, because when people have mental health difficulties, sometimes there's harm caused to others, often family members or someone they know. And in our services, I am enabled to work with and alongside nurses, doctors, social workers, psychologists, occupational therapists, and community organisations to support patients and victims to find a positive way forward from the harm that's been caused. And all these professions support patients on their mental health recovery journey. And we believe the restorative interventions we provide are very much health interventions. They create healthier people, healthier communities, and hopefully healthier institutions. We work with individual cases to support this process, and we've developed other restorative interventions that support patients to connect with their own victimhood, which creates a fertile platform to explore other restorative options as part of their recovery. I hear you ask, what is restorative justice? Well, very briefly, it brings people who've been harmed and those responsible for the harm into communication, enabling everyone affected by a particular incident to play a part in repairing the harm and finding a positive way forward together. The process is a series of individual preparation meetings that are convened and hosted by 2 qualified and trained restorative practitioners. In our services, there's a mental health professional supporting the patient in each case we are referred. It's always voluntary and there's no time limit placed on the process. Another part of our project is called the Reflective Circle. This is a protected space for family and carers to talk about the wider impact of having their relative in hospital. They can share their needs in a safe place with others who may have experienced similar. So the Restorative Circle, in closing, supports raising awareness, educating staff and patients on restorative ways of working and dealing with incidents. We also collaborate with community organisations to support and enable restorative justice to go ahead. We do this through shared facilitation, clinical supervision for mental health cases and sharing of specialist knowledge. And that's why we're here today, recognising the value and pivotal role that working together can resource so much more. Thank you.
Thank you, Finn. Lots to come back to you on there, but can I turn to Julie and just ask you, Julie, if you could just say a little bit about the restorative justice work of your service with victims of offence.
So we are the Pan London Restorative Justice Service. So we work right the way across London with victims of crime. So we're not specific to mental health, but restorative justice is very much about well-being. So it's looking at well-being of the victims and how they might move forward and what they need from the restorative process. Finn talked about repairing the harm and being able to move forward, but quite often there's a little bit more to it than that in the terms of victims might have questions about the offence that they need answering that might help them to move forward from their experience of crime. So it really is about well-being, but it's also about the well-being of the offender as well, because we want the offender to get something out of the restorative justice process, obviously. So it's about looking at reducing crime, looking at getting people to think about the consequences of their actions and the harm that they've caused to other people, not necessarily, as Finn said, just the victim, but the ripple effect. So, you know, the victim themselves, family, friends, looking at the harm that's been caused and how we might move forward from that.
Thank you, Julie. Okay, and if I can then turn to Gerard. Gerard, why is this important in mental health care?
Yeah, thank you, John. And just following on from what Julie said, I mean, some years ago now, perhaps about 8 years ago, we started to think about how to bring restorative interventions into mental health services, because of knowing that there were organisations like Julie's and CALM and communities that really people who have mental health difficulties weren't routinely able to access those services. But also, most importantly, is the people who'd been harmed by someone who had a mental health difficulty. They often also were excluded from being able to participate in restorative processes. So, and that's partly because there's a very, very strong assumption that people who have mental health difficulties can't participate. And it's just not the case. That it can be more complicated, but it is still possible. And the way in which to make it possible is by having the clinical staff who work with patients understand restorative processes. But in fact, that was the other problem, is that actually there's a very low level of knowledge or awareness within clinical practice about the benefits and the possibilities of restorative justice and restorative practice. And that inevitably makes people cautious, because as a clinician, your first rule is, first do no harm. And so therefore there would be an erring on the side of caution, perhaps. And so what we've been doing over the past few years is trying to create awareness within clinical communities about restorative practice and restorative justice, and to try to create frameworks and structures within which it becomes possible for victims and people who have mental health difficulties to access restorative processes safely.
Thank you, Gerard. Just to ask, if I'm a member of the public checking into this broadcast, not very aware about restorative justice myself, I wouldn't know if this was pioneering work you were doing, or if you were building on a platform that's already there. Could you say a bit about that? It sounds like you're doing something new, but say a bit more.
Yes, there is a newness to trying to do this. I mean, any member of the public can approach CALM, can approach Julie Service and say, look, I would like to participate in restorative interventions. And the fact that the person who caused that harm may not be, that shouldn't really matter. But actually, I think in reality, it does matter, because services may feel cautious about saying, well, perhaps the patient or someone who is a patient who has mental health vulnerabilities, they shouldn't participate because it would be a risk to their health. Or there's frequently a worry that someone who has mental health difficulties will participate in such a way as to make things worse, that they might respond to restorative justice is all about meeting, coming together in some way. And if that goes to the point of a face-to-face meeting, there would be a worry that in that meeting, someone with a mental health difficulty would participate in such a way that someone might be more upset. So what we're trying to do is to help people with difficulties of access, I suppose, be able to be on a ladder of preparation for being able to participate in such a way that they benefit, but also the people who have been harmed can benefit.
Thank you. Right. Okay. That's helpful to understand. I mean, Julie, can I turn this question your way? I mean, so if I'm a member of the public, how do I find out about your service? How do I access it? Tell us about your work in that way.
So there's a number of ways that you can access restorative justice. If you have a support worker, whether that be in mental health or victim support or any other organisation, you can speak to your support worker. If you visit our website, you can see there's a number of ways to get in contact with us. You can request a call back. If you report to the police, if you report a crime to the police now have a new leaflet that specifically mentions restorative justice, so you can get our telephone number from there. And we do take self-referrals as well as referrals from professionals. Just really to touch on a little bit about what Gerard said about kind of having access to restorative justice. That's the importance of multi-agency working, so that we can work with other agencies, so that we can manage risk. We know that we're working with people who might have additional needs, so it's really important that us as a service are able to reach out to SLAM, to Gerard and Finn, and domestic abuse services and all of those services who can support us in managing the risk, because we're the restorative justice specialists, but we're not mental health specialists and we're not specialists in domestic abuse. So it's really important that we engage in that multi-agency approach to make sure that we are able to manage risk and make sure that everybody gets the access to restorative justice that they're entitled to under the Victim Code of Practice. That's not to say that it would be safe to progress every case, but everybody has the right to explore what their options are and see how they might move forward. And of course, if restorative justice is not an option for them because of risks, it's really important that we make sure that we're signposting people onto other services where they can get the support that they need.
Thank you, Julie. When you're thinking about this in your service, what are the kinds of risks or situations that might make you think, maybe this isn't the place for restorative justice? Just picking up on what you said there, what do you have to take into account there?
Well, they're different for everybody, so it depends what additional need you have. So if we're talking about additional mental health needs, we'll be looking at triggers, what triggers people. We'll be looking at kind of people's background information, what's happened in the past, how have they been able to cope with difficult things in the past, and just looking at whether or not there is a way forward. And that's where the care coordinators kind of come in, because they know that person that you're working with, and they know what to look out for that perhaps you don't. And that's why we always ask if the people who are participating in the process want a supporter with them, and that supporter can be their support worker, so it could be their care coordinator or their IDFA. So looking at everything really. And it's a bit of a misconception that restorative justice is we get a referral and then we kind of go straight into the restorative process, but the restorative process starts with lots of meetings individually. So meeting with the person who's caused the harm, meeting with the person who's been harmed, and looking at what's the way forward. Lots of preparations, looking at what they hope to get out of the process, and how that might be achieved, and how they might feel if that wasn't the actual outcome. So it's looking at kind of where is this going to go, and how are we going to prepare everybody for whether this is a conference face-to-face or whether it's done by letter or shuttle mediation. So there's many options available, and we're managing risk all the way and using our multi-agency networking to be able to do that.
Thank you. So I just turn to you, Finn, and ask you what your thoughts about the challenges and the benefits of bringing kind of victims and offenders together in this way, maybe particularly in a setting where kind of power differentials are sometimes very, very marked for all sorts of reasons. What's that like, and what's your experience there?
I think, one of the risks that we really manage closely is that sometimes talking about the story and the harm, again, for both parties can be quite difficult. And people can get quite upset, again, talking about that. For example, we have a case that's been going for nearly 2.5 years, because of that very reason that it's difficult for both parties in different ways, managing, retelling the story and thinking about meeting again. So it's important that there is no time limit and that people can take it at their pace.
Right. I've got thanks for the audience. The audience is reaching in with some questions, and there's a couple of questions I'm going to put to you, Julie, really about the impact of the pandemic. I think it's really what we're asking is the impact of the pandemic on service delivery in restorative justice. Julie, yeah, how's it going in that regard?
It's actually going really well, because we've been able, it's kind of launched us into a new era of technology, which probably we should have been using for quite some time, and it's been really useful. So we do our meetings on Zoom, and they're working out really well. It means that we can move slightly faster because the logistics of getting everybody together in one place has been removed. So it's great. We can get our first meetings in with victims much quicker. Obviously, it's had a bit of an impact on progressing cases to offender involvement because some of the offenders are in prison, and that's caused a little bit of a hold up for some cases, but as Finn said, restorative justice takes time. It's not something that you can rush, and we manage expectations right from the very beginning, that there is no time frame on it. Everybody takes it at their own pace. So when things have slowed down a little bit over recent months, it hasn't really caused anybody any great stress, because they know that this is a process that takes some time. But certainly the Zoom, we do find as well that people are responding quite well to Zoom. We were quite worried about it in the beginning, that people maybe wouldn't feel so comfortable speaking not face to face, but actually I think some people do feel that they're able to express themselves better when they're a little bit removed from the room, if you like. So it's working really well, and we're business as usual.
Good, so that's good to hear. Still open for business. And there's a couple of questions. Maybe Gerard, I could ask you this. People are asking, what's the training pathway to being able to be a restorative practitioner? Would that be the phrase? But and a particular feels like a particularly important question: can peer support workers be trained to offer this intervention? So, say a bit about the training.
Yeah, so it's such a good question. I'm really grateful for that, because what I was interested in restorative justice for a very long time, and it was really only doing the training that I began to understand really how this works. The training is usually 3, 4, maybe even 5 days, and usually it's a training to do what's called conferencing. So that is when there's a preparation for bringing someone who's been harmed and someone who has caused harm and their supporters together. Usually it's a meeting that's held with 2 facilitators. And there's all the preparation that Julie's described. So there's a 4 or 5 day training that involves acquiring the skills to do those preparation meetings, to understand what's required of each of the parties, how to do that safely, how to risk assess in order to manage it safely. But the training's not enough in itself. It's really important to have ongoing supervision. And yes, absolutely right. The role peer workers can be really important in that process. And usually what we would want to do is to have, in a mental health setting, we'd have a peer worker and a clinician pairing in some way, that there would be that coming together of perspectives. And why the peer voice is so important is because restorative justice really challenges our clinical model. Our clinical models tend to be really individualistic, but actually restorative justice is about community healing. If someone's been harmed, it's not just them that's affected, it's also their mother or their father or their children or their grandmother. So actually the ripple effect of harm invades a whole community, and what we're trying to do is to focus on recognizing that we can support healing communities, not just individual patients, through the restorative process. And of course the peer community has got a really important role in that as well.
Thank you. Okay, so I wondered if I could also ask you, Gerard. I get the sense that there's a range of kind of more formal and less formal interventions that we're talking about here. I wonder if I could sort of tease that out a little bit with you, what the range of interventions is here that we're talking about. Yeah,
so it's referred to as the restorative spectrum, where you can go everything. I mean, at the most complex end is direct meetings between people who have been harmed and people who have caused harm. And that's what I referred to earlier as conferencing. But also you can have a letter exchange. You can have a meeting where the person who's been harmed or the person who caused the harm isn't present themselves, but they're represented. And then, so there's a range of indirect ways in which to participate as well. And I think that's where, as clinicians, we're not actually familiar enough with the full range of options that a service like Julie's could offer. You know, there might be a tendency to say, well, the patient can't participate face to face, and so therefore it can't be done. But actually, there are a huge range of options that could be explored if only we understood them better. And so in a way, I suppose this broadcast is a great opportunity for us as a mental health service to put a call out there to the wider community to say, look, challenge us as a mental health service to make restorative interventions available to you by being good enough. We want to be competent and skilled in order to make this possible. And so we need to do more to be ready to support everyone to do that.
Julia, can we ask you where do most of your referrals come from, and are there any I suppose areas in the community where you'd like to see more referrals coming? How's that outreach working in terms of who refers to you and who gets referred?
Okay, so the bulk, we're a partner of the London Victim and Witness Service, so we get lots of referrals from victim support. We get lots of referrals from victim liaison officers within the probation service who are working with victims where the offender is serving a custodial sentence, and the VLO is there to kind of keep them updated as to what the next steps are in terms of the offender's release and information like that. We get referrals from the police. In answer to your second question, what I would like to, and self-referrals, sorry, I must mention self-referrals. In answer to the second part of your question, what I would like to see is more victims being offered restorative justice. So for all of the statutory and the voluntary agencies who are working with victims of crime, to have an understanding of restorative justice, to know how to refer or to signpost in. And I think that momentum is growing, and it has been growing over the last few years, and it continues to grow. But I would like to see more victims being offered at various different stages throughout their experience of crime. So a victim goes on a journey. So they experience crime, they report it to police. They may or may not go through the criminal justice system, and then, you know, it's different. Their journey changes, their needs change throughout their journey. So it's really important that if restorative justice wasn't quite the right time or the right thing for them at the beginning of their journey, it's really important that they're offered it throughout their journey, and they have that knowledge of how they can access our service so that they can access it at a time that's right for them.
Thank you. I'm conscious of the time. We've had a terribly important question come through towards the bottom there, which the moderators responded to. I wonder if we could have that conversation. We haven't got time to open that conversation now, but I wonder if we could find a way to have that conversation with Anonymous, who's written about children's experience in schools. Please, can we please stay there and let's find a way to make contact. I just need to ask, Julie, you've kind of said what you'd like to see. I'd just like to ask Finn and Gerard in a line, what's your wish list for restorative practice, bearing in mind the time? You may have a long list.
I think it's similar for me to Julie, that I would like to see more victims, particularly victims of our patients, being able to access restorative justice, which currently is not the case. I would like to be part of changing that.
Is there, oh, it's the last one for me. Yeah, just access as well. So people with mental health difficulties, either before they had experience of victimization, or who have mental health difficulties as a result of their victimization, that we are better able as a mental health service to support them to access the benefits of restorative justice, but also people who have been harmed by people with mental health difficulties, that they can have access to.
Thank you. We need a couple of days, but we haven't got time for any more. Thank you so much to everyone for your participation. We will try and follow up some of the questions that have come through on the Q&A, but there we must leave it in terms of the live broadcast for today. Thank you very, very much for your attention.